The following is a special presentation of Channel 4 News.
A new year often inspires a fresh start. Coming up in a special Healthy for Life, cutting-edge treatments give a chance at a new beginning. From better vision to a sharper profile. Plus, a stunning revelation about the rise of HIV. And a new approach to help those battling addiction. Need more fun in your workout? Your mama's jazzercise is hipper than ever. Channel 4 has made a promise to inspire Middle Tennesseans to live a healthier lifestyle. It's our goal to educate viewers on ways to be healthy for life. Hi everybody, I'm Tracy Cornett. During the next half hour, you'll see it's never too late to start over. You'll learn some of the medical breakthroughs and treatments giving folks young and old a fresh start, and in some cases, a second chance. We begin with a young man who's experienced both because of a bad case of the flu. You may have experienced its aches and pains and fever, but if an infection such as pneumonia creeps in on top of it, it can be deadly. Doctors say a 14-year-old would have never survived the terrifying combination if it weren't for a special machine at Vanderbilt Children's Hospital and a program that's now among the largest and most successful in the world. Adam Cove was 14 years old, active and athletic, when he was diagnosed with the flu. He took the proper meds and spent 3 days in bed. But Adam just got worse. He told his dad to take him to the hospital, and when they got there, Adam was near death. He was flown by medical helicopter to Vanderbilt.
This wonderful child, this gift, I couldn't have him for only 14 years and have him be gone.
He had heart failure, he had lung failure, and he had kidney failure. And he was really sick.
Dr. John Peach had seen how this machine called ECMO, or extracorporeal membrane oxygenation, saves lives. He brought it to Monroe Carroll Jr. Children's Hospital at Vanderbilt 25 years ago. He believed ECMO might save Adam.
We could bypass his lungs, bypass his heart, and still have him okay.
ECMO helps the body buy time to get better, taking over the heart and or lungs, allowing the medicine to kick in.
And that little blue box is actually a lung. And so that allows oxygen to get to the blood and to carbon dioxide to get out. And it also warms the blood up, and then it goes back to the patient.
Adam spent 10 days on ECMO in a coma.
Dying was not an option.
We never left Adam for almost 2.5 weeks.
Adam's parents promised if he'd come out of that coma, they'd take him to Hawaii. Finally, signs that Adam was waking up.
They said, "Can you give us a thumbs up, Adam?" And I went, a peace sign, and I went.
Everybody started dancing and crying.
It was quite remarkable. I remember the joy and happiness in the room.
Adam got stronger, got back in school, was determined to run again, and did. He made the track team his senior year, and last month walked the Mount Juliet High School stage with his graduating class.
But I was determined I was going to graduate, and I was going to prove everyone else wrong.
A few battle scars show how far he's come.
And then right here where they had to cut into my jugular.
His left hand is paralyzed, though he's recently felt new movement.
I'm going to get my hand back. I'm going to be using my hand like everybody else.
And as for that promise of Hawaii, Dr. Peach has the proof framed on his desk.
Our faith in God, the support we got, the doctors here, and that wonderful machine, Adam was able to come.
Vanderbilt saved my boy's life.
I checked in with Adam and his family now 8 months after we first met with them. He's now in his second semester of college and has gained more movement in his left hand. He's determined to not give up until he gets it all back. We'll keep you posted. Now to a new treatment helping aging eyes see again. Put away those readers, folks. After 10 years of research and clinical trials, the FDA has approved a procedure to reverse presbyopia. That's when the eye muscles that control our ability to focus start to weaken. And a Nashville surgeon is among the first in the country to perform it. Kim Terrell of Brentwood couldn't believe her eyes when she spotted an ad on social media. It claimed to cure an increasingly annoying ailment the Belmont professor has been battling the last few years.
I'm getting tired of chasing around 10 or 12 different pairs of readers. I can't even see my food now. my plate is blurry. I can't fathom what I'm going to be at in another 10 years.
The 50-year-old wife and mother called, researched, and within days scheduled an appointment for 3D laser camera surgery with Nashville eye surgeon Dr. Ming Wang.
We're the only center in Tennessee offering that. And we did the first one on June 9th. I did 11 patients.
Just approved in April by the FDA, camera involves implanting a tiny plastic ring into the cornea in one eye only. The pinhole effect forces light to enter the eye in a narrow beam, which increases both focus and range of vision.
This with a ring that, because it doesn't affect the muscle, it will gives you another way to get up close vision without having to rely on the muscle.
Patients must be 45 and older and have good distance vision or have had LASIK surgery to make them that way. During the 10-minute procedure, patients feel pressure but no pain, and the results are almost instant.
Congratulations. Thank you. You're welcome. This is an excellent beginning.
The most common side effects of 3D laser camera surgery are dry eye, halos, and night vision disturbances. Dr. Wang tells me his center has performed some 60 laser camera surgeries so far. 95% of his patients no longer need readers. One has had the lens removed. Chronic obstructive pulmonary disease, or COPD, steals a little more of your breath day by day. These patients say a $5 musical instrument is changing that. When country music star Chris Janson picked up the harmonica to add some flair to his on-stage routine, the 29-year-old Nashville musician discovered a sensational side effect. The breathing problems he'd battled since youth quickly improved.
So my vocals got stronger, which in tune my chest got stronger, my lungs got stronger, and now we play 90 minutes a night.
And Janson isn't alone. St. Thomas Rutherford in Murfreesboro is the first in the country to test the pulmonary care program Harmonicas for Health.
If you're blowing against a harmonica in the C note, it gives the same resistance that we use for resistance training in pulmonary rehab. It strengthens, it opens the airways.
Janson recently shared his story with patients there.
I grew up in a smoking household, and with windows up in the cars and that kind of thing. It was just part of the culture.
If you're smoking, quit. Oh, for heaven's sakes, quit.
Patient Glenda Green of Liberty says the program's making something beautiful of a terrible disease.
I can breathe much better. I'm able to do things a lot longer. I can walk further.
Plus, it's fun.
Great group of people. Oh, we laugh as much as we play the game.
The 5-week class has become so popular, they've capped it at 26 people. Patients are calling for perpetual encores.
At 5 weeks, they told me they weren't quitting. And they've got enough strength now that I can't argue with them.
Most people know someone who's battled addiction. We'll show you the drug that's making it easier to quit. Plus, HIV has a lot of you talking since Charlie Sheen admitted that he's tested positive. We talked to a top doc who says there's a disturbing trend happening here in Middle Tennessee when this special Healthy for Life continues. An implantable pellet is giving those battling alcohol or drug addiction a fresh start. It works by reducing or eliminating cravings. And because it's implanted, it helps reduce the risk of a patient not taking it. A former child actor says it's helped save his life, and it's inspired him to help others. Jeremy Miller grew up in the spotlight as one of the child stars of the 80s sitcom Growing Pains. But his life turned dark at age 19 when he began drinking heavily for years, all day, every day.
I realized I can't live like this anymore. I cannot do it. And for 3 years, I struggled to stop.
But nothing worked until he discovered Start Fresh Recovery and Dr. George Falieris's new approach to treating addiction, an implantable form of the drug, naltrexone.
So patients get a very low but effective dose of this medication to help eliminate these compulsive cravings to drink or use drugs.
What you notice is that lack of craving, of need, that is such a part of you. And all of a sudden it's just like someone flicked off the light switch.
It allowed him to finally focus on the counseling he needed to change his behavior.
Once they received the medicine, They say to their counselors, now I can focus. Now I can hear you.
The medication is implanted inside the abdomen during a 20-minute outpatient procedure. It slowly dissolves over 6 to 8 months, giving the addict the chance to fully participate in therapy and counseling programs without withdrawal.
But he's doing great.
Jeremy's been sober for 2 years now. He was so impressed with his recovery, he's working for the center as a patient advocate.
Sobriety is an incredible feeling. It really is. I could not imagine back then the life that I have now.
The medication is only one part of the program. Patients must also commit to counseling and behavior changes. The program costs around $20,000, but most insurance companies pay a large portion of that. Patients have reported minimal, if any, side effects, which we've listed in full on our website, as well as contact information for Start Fresh Recovery. Just click on Healthy for Life. Actor Charlie Sheen's HIV diagnosis sparked a lot of questions about the virus that, if left untreated, can lead to AIDS. I talked with the medical director of Vanderbilt's Comprehensive Care Clinic for the latest in HIV treatments and trends. Something he revealed stunned us all. HIV is on the rise in college students.
In 1996, everything changed because new medicines came out that treated the virus.
Dr. Stephen Raffanti says the future of HIV is filled with hope.
I don't think it's unreasonable to think that we could cure HIV.
But the professor of medicine at Vanderbilt says he and other HIV experts are seeing a disturbing new trend. HIV is on the rise in college students.
A larger portion of our newly enrolled patients at this clinic and at many centers across the country are from the age group 18 to 22.
Raffanti says before 2007, 2% of his patients were in that demographic. Today, 15 to 20% are college students 18 to 22 years old.
Oftentimes when we come in the room, they know what medicine they want to go on in their first appointment.
But why? Raffanti says social media could be a factor facilitating casual sex, combined with social alcohol acceptance on campus, which leads to high-risk behavior.
These are not just college-age kids. I want to make it perfectly clear. These are college students, okay? They are going to some of the best colleges and universities in the area, in fact, all of them. And they're smart people, and they're accomplished people, and they're going to continue to be accomplished. It's just now they're going to have to treat their illness.
Raffanti says there's a new movement to screen college kids, immediately link them to care, and treat their HIV. Another major development, Truvada, the FDA-approved daily medicine to prevent HIV.
So what message should we be telling our young people?
I think it's really important to feel empowered to control the risk in your intimate relationships.
When his Nashville clinic opened in 1994, half of the 700 patients enrolled died in the first year. Today, he tells new patients they may be around for the cure. A local doctor is the first in the area to use a treatment that targets that dreaded double chin. Could it work for you? See for yourself when this special Healthy for Life Fresh Start continues. It's probably safe to say no one likes a double chin. The FDA recently approved a treatment to make it disappear for good.
I was looking at the pictures and I was just like, oh my goodness, look at my double chin. I've got to do something about this.
Geneva Curtis of Nashville is about to eliminate her #1 hang-up, her double chin.
It's really important. This is the one part of my face that just really bugs me.
So the Nashville hairstylist and mother of 2 is trying Kybella. Recently approved by the FDA, the injectable permanently destroys the fat under the skin.
We need someone who has well-trained in the anatomy of the face.
Dr. Deborah Sherman first maps the face, preparing it for the series of injections. No surgery required.
Most people are able to return to their normal routine right after the treatment.
The Nashville cosmetic surgeon, the first in the Southeast to teach other physicians on the procedure, says clinical trials have shown that patients see 80% of the results within the first 2 treatments. Results like these.
Especially because the double chin is the area that bothers many men. We're going to see a lot of working professional men interested in this technique. It's very exciting to be able to see patients have that little kick of confidence.
Kybella treatments take less than 20 minutes. Side effects include swelling, bruising, and numbness. We checked in with Geneva to see her results. Here's a look at her before and after her third treatment. She says she's so thrilled with her new profile, she had the courage to cut her hair for the first time in 20 years. Next, why patients at Vanderbilt Children's Hospital are reeling with delight. It now has a working music studio, all thanks to media mogul Ryan Seacrest. He's one of the biggest hosts in Hollywood, using his star power for good. Ryan Seacrest opened Seacrest Studios inside Vanderbilt Children's Hospital, a state-of-the-art multimedia broadcast studio for kids to learn and have fun while they're working to get well. Seacrest says the idea was birthed years ago after hearing from parents what they needed most.
What if we built these TV and radio studios in children's hospitals? That'd be kind of fun. And we could have celebrities come by and we could broadcast to all the rooms so no patient is excluded, even if they can't get out of their bed. They could call in and request songs.
This is Seacrest's 10th studio, and this time he showed up with an extra special surprise.
Ladies and gentlemen, Taylor Swift.
Nashville's own Taylor Swift shared her love of the project and Seacrest's commitment to kids.
About 2 years ago, I was lucky enough to get to visit Ryan's studio at the Children's Hospital of Philadelphia. And what I saw when I went there was an opportunity for the kids to find excitement and to express their creativity and to learn about what it is to create content and